Hi, I'm Dr. Chris Anthony, and I'd like to take this opportunity to thank the National Heart Foundation and their donors for their support of my PhD, which evaluated the use of cardiac MRI and novel tissue characterization techniques in the evaluation of heart transplant rejection. Approximately 100 Australians receive heart transplants every year. Most patients experience some form of organ rejection, and while survival rates are generally high, 10% of patients will die in the first year post-transplant. It is essential that we monitor these patients closely and with a high degree of accuracy when detecting heart transplant rejection. Most clinicians around the world, and over the last 50 years, utilize an endomyocardial biopsy technique to take samples of the transplanted heart, which help them determine the severity of rejection and guides the dose of immunosuppression required to treat the acute rejection episode and prevent further rejection episodes. We now have a tool that can do this without the need for this highly invasive biopsy type procedure. The virtual biopsy technique we developed takes less time, is non-invasive, more cost-effective, uses no radiation or contrast agents, and most importantly, spares patients from repetitive, painful biopsy procedures that in and of itself can result in life-threatening complications. We conducted an exploratory randomized trial that assessed the feasibility of a CMR-based surveillance strategy for the detection and management of transplant rejection in the first year post-transplant and compared this to a traditional biopsy-based surveillance strategy. We found that multiparametric tissue mapping techniques by CMR reliably graded acute rejection and resulted in equivalent immunosuppression exposure without increased risk of infections, hospitalization, death, transplant, allograft dysfunction, or kidney injury when compared to the traditional biopsy method. In addition, a CMR-based strategy significantly reduced the number of biopsies required by up to 94% in the first year post-transplant. Your support was directly responsible for the success of this first-in-world study, which has now been published in Circulation. Once again, I take this opportunity to thank the Heart Foundation, their donors, for their continued support of groundbreaking Australian research and Australian researchers.